it was easier for me to open myself to him. I knew it was the right person for me. I felt that progress was made after the second meeting. Things were beginning to reveal from within, release from within. Every time I had a meeting with him, I felt liberated. It really felt good. The progression I followed during my therapeutic treatment, if we can call it that, was gradual. After my meetings, I felt very good, relieved, and often tired physically. I could go to sleep in peace, without a care. At times, periods of anguish would come back, but slowly they diminished. I developed tools to work on my anguish.
Les périodes d'angoisse pouvaient s'éloigner graduellement, mais on dirait que j'avais des outils en dedans de moi pour pouvoir travailler ça. Il y a des choses qui se sont révélées de mon intérieur.
Things started to reveal themselves
souvent,
from within me.
Que je manifestais pas,
the fact that I didn't express, or that I would not say what I thought or felt just to please people or to harm them. I wouldn't say anything. I wasn't open to others. But now, I'm more open to people. If there are people I don't like, I let them know. Now they know. The things that really helped me in my moments of suffering were that I could call my hypnotherapist at any time. They weren't meetings, for example, Monday from 7 to 8. The sessions could be extended to meet my needs. I had at that time, he was open to my needs. That way of doing things gave me a lot of confidence. I can say that after those 3 years, there has been a lasting change in me. When I have periods of anguish, I know that I can react. It comes to me more naturally than before. That really helped me. It gave me confidence in myself, and it reflects on everything. Yes, it gave me back confidence in me. I lost a few years of my life where my confidence went down gradually to a state that was tragic, but gradually it came back. And that is the main thing about the therapy. I would recommend an hypnotherapist or therapy with an hypnotherapist to everybody that feels the need. I'm not shy to say that I was helped by an hypnotherapist. I recommend mine, but I don't know the others, but mine I do recommend. I think that you have to be ready before meeting an hypnotherapist. You have to feel ready to free yourself of your anguish that are inside. It's us that make the work. The hypnotherapist is there to help, but if you're not ready for it, it won't work.
By now you know that this show is about hypnosis, and it's important for you to note that hypnosis is in fact an integral part of alternative medicine. But it's also important for you to know that the College of Doctors do not agree with the free use of these various natural techniques. However, the group My Health, My Rights represents consumers who want to, in fact, choose freely their medical options. And this week, as in other weeks, we're going to see what they have to say on different topics. It's very interesting to get a different perspective from these people, because they are looking to represent all of the consumers. So we all have our right to choose which kind of medicine we want, or techniques we'd like to be used when it comes to our health and our choices. So let's see what they have to say.
Good day. Today we'd like to entertain you about the promotion of preventive health. We think that My Health and My Rights' most important feature is the preventive aspect, because without a preventive philosophy in terms of health matters, there is no future for the province of Quebec or even for Canada. Now, as you know, the budget pertaining the health care in Quebec is towards $15 billion, and none is given for the preventive aspect. And when we talk of freedom of choice in terms of health care, we also include in that preventive aspects. Micheline could easily talk to you about preventive with the experience she had with her child.
Yeah, well, just what I want to say is that the National Institute of Health in the United States just after 25 years of research in curative methods, treatments, they just admitted last year for their 25th anniversary that they were going the wrong way by trying to work in curative way. Instead, they have to put all the efforts on the prevention. So this is what we are mainly talking about today. Prevention in cancer? Prevention in cancer, or in any kind of health-related problem. Prevention is more easy to it's less costly for the system first, okay, when you work in prevention. So it has a direct effect on our financial health, if I can say. Yes, and when we look at our public economy, one has to think about the problems we have right now, and it will certainly not be resolved with a curative approach in the future. So that's why I guess presently the big movements in North America is to work towards prevention, and this has to be done through consumers regroupments. Otherwise, healers do not have the power to change the laws. Yeah. And we could see that in courts every day. And people, they have to take charge of their own health regarding this, being more aware of what they eat and the exercise they do, and looking to have their medical records with themselves. Make it accurate, so when you go see a practitioner of any kind, I mean, you have your medical record with you, so you are completely at ease and independent, and feel free to go see whoever you want. And by doing this, it really responsibilize the people on their own health. So I think that this is the recipe for the future. Yes, actually what we have done in the past is we have created charters of rights, and we have not responsibilized people. So in other words, we have a good healthcare system that we claim in the world, but on the other hand, the participation of the individuals towards the health system is zero. Exactly. We don't ask the people to participate. They are like people who go into hospitals, they are sick people, and the evolution of their health has no matters in the philosophy of our present healthcare system. So that's why we think that the only way to improve, if we can even speak of economy, because when we think that 40% of all the income tax money goes for the healthcare system, it's enormous, and the baby boomers are growing older, and so that means in the near future, 10, 15, 20 years, there's going to be enormous amounts of baby boomers in hospitals, and who's going to pay for that? Yeah. So that's why there's problems that are coming ahead in our society, which we have to think about. If we would have responsibilized the citizen immediately from his birth, then when he becomes at the age of 50, 60, he does not become a fardeau, a burden for the state, if I can say so. As right now, that's what what is going to happen, and that's not logical.